All right, last topic for today. A very common issue in adolescence is depression. It's 15 to 20% of adolescents have had one or more major episodes with depression during that period. It's much more common in girls than it is in boys. And we'll talk about that in just a minute, why that might be, but that is a gender difference that's sustained, not just in adolescence, but also through adulthood. In adolescence, adults tend to see any kind of moodiness as just like a common thing or a phase that they're going through because of their hormones or whatever it might be. And because of that, a lot of really serious cases of depression are often overlooked or minimized because they're looked at as just being sort of like phase that this teenager will come out of once they're done going through puberty. And in some cases that may be true. It may be just like a short-term phase that they're going through. But in a lot of cases it is, like actual clinical depression that probably should be treated and dealt with in a more serious way. Some of the factors that relate to the risk that someone has of developing adolescent depression, there is a heritable component, so it's been shown that there's particular genes that are involved in depression. Mostly they play a role in like the neurotransmitters you have in the brain. It has also been shown that hormonal changes play a part, but it's probably a much smaller component than people assume it is. The female hormones, things like estrogens, have been shown to increase rates of depression, so that may be one reason that depression is more likely in girls. Also gender-typed coping styles. We talked about how girls tend to co-ruminate more than boys do, and so spending all that time talking about negativity and negative emotions may contribute to depression. It's also been shown that parental depression can increase the rates of adolescent depression, both because of the genetic component, but also because the parent is then sort of modeling that behavior for the child. Genetic and hormonal risk factors combined with stressful experiences, things like negative life events. Obviously, if something really traumatic happens, then that can kind of trigger depression. If someone developed that learned helplessness style that we talked about in middle childhood, then that's also been shown to be a predictor of depression as well. So unfortunately, because of these high rates of depression in adolescents, suicide rates are sharply increased during adolescence compared to earlier middle childhood. Maybe counterintuitively, even though girls tend to be depressed more often than boys, boys are much more likely to commit suicide or to die from suicide. They're about 4 times as likely. That's partly due to the fact that they have more risk factors, so they tend to be more likely to engage in like substance use, for example, and they tend to also be more aggressive. Both of those have been shown to predict your likelihood to commit suicide. Gender role expectations plays a part in those risk factors. There are also ethnic components. Going back to boys, I thought I had this on the slide later, but it's also true that boys typically tend to choose a method of suicide that's more effective compared to the methods that girls choose, and so girls are more likely to attempt suicide but not be successful at it. And so that's another reason you have the increased incidence of deaths from suicide. Like I said, there's an ethnic component. African American boys and Native Americans tend to have higher rates of suicide. Obviously things like family environment, stress, poverty, etc. play a role. Sexual orientation also plays a role. Adolescents who are bisexual, gay, lesbian, etc. Tend to be more likely to commit suicide. There's also personality factors contributing. Adolescents who are intelligent and withdrawn and have really high standards for themselves, or feel like other people have really high standards for them and feel like they can't reach those standards, tend to be more likely. And also adolescents who are either antisocial or hostile or engage in destructive behavior have a higher risk as well. And then just like with depression, it has been shown that if a really traumatic negative life event happens, then that can trigger depression and also trigger suicide. All right. I would say, unfortunately, there's probably not enough useful information out there about how to prevent suicide, and even the stuff I'm giving you I personally have never found anything that I feel like is like a satisfying response. Like, what should I do if a friend of mine expresses this, if they say that they want to kill themselves? There's unfortunately maybe not a ton that can be done other than, treatments like medication and therapy. But some prevention efforts that have been suggested, trying to attend to warning signs. So if someone is saying that they are going to kill themselves, to take that seriously and not ignore it or think it's just a call for attention. Looking for other warning signs if someone is less interested in activities that they used to be interested in, if they stop showing up to school, if they're not taking care of themselves, maybe they're not showering, they're not taking time with their appearance the way that they did before. Those would all be warning signs that would be useful to pay attention to. So training adults and adolescents to look for those signs and what signs to look for can be helpful. Providing adult and peer support, so whenever someone has those warning signs, having someone reach out to them. Offering information about things like telephone hotlines that they can call to get support as well. Schools and communities developing supportive relationships like I just talked about. There is some evidence that having gun control legislation can limit the means to guns, which will reduce the amount of successful suicide attempts. And if someone says that they are suicidal, then staying with that individual until some sort of professional help arrives can also be helpful. Some of the treatments that are used to treat depression are things like medication and therapy. If there has been a suicide that has occurred in a particular group, in a high school or something like that, then it's also useful to kind of keep an eye out for the other members in that school, particularly their other friends, because they may be vulnerable to now basically following in the footsteps of the person who killed themselves.